Starting your weight loss journey may be the hardest step to take, and there are many options, including medical procedures, that we're exploring here today. And here to tell us more are doctors Mahmuda Tasneem and Shanley Deal with Virginia Mason Franciscan Health. Thank you both for being here. I know you're both very busy, so we appreciate your time. Dr. Deal, I want to start with you. Why is maintaining a healthy weight important?
Well, it's really the foundation of all aspects of your healthcare, and it really comes back to that and influences all disease processes. So really developing that foundation and having healthy habits and behaviors to impact all of those areas is important. And that's why we spend most of our time focusing on that in our practices at Virginia Mason Franciscan Health.
Definitely. And what factors should really be considered when someone's thinking about how they need to lose weight?
We really value a multidisciplinary approach, so tackling it from both dietary changes, lifestyle modification with activity and exercise, thinking about what medications might be helpful to achieve those goals, and then considering surgery in some cases where we think that benefit is significant, helps us really take care of our patients better.
Definitely, and I want to get to you. So you specialize in medical weight loss. How do weight loss medications serve as a tool to help with lifestyle changes?
To piggyback on what Shanley was saying, we approach weight loss by four-prong approach. The focus is on lifestyle, and the lifestyle mainly is what you eat, when you eat, how much you eat, why you eat, where you eat, the food choices. And the second is activity. That is the most important part of weight loss. You are helped by taking a medication or having surgery or doing both to achieve the first two. So lifestyle is a must. It has to happen for you to be successful. So for instance, you have not eaten good all your life. I can give you a medication, and if you take the medicine, what will happen is without you making any effort, your intake will go down. And when your intake goes down, your weight will come down, but you won't get the effect you want unless you make those dramatic changes.
It makes perfect sense. And who are good candidates for these medications, would you say?
So at this time, the FDA approves medications only if we go with a BMI, we use BMI. It's not a perfect tool, but that's what we use. So a BMI more than 27 is who qualifies for medications. Anybody with a lower BMI, lifestyle is the main focus.
Makes sense. And Dr. Deal, I want to get back to you. Surgery sounds like an extreme measure, but you specialize in bariatric surgery. Can you explain what that is?
Yeah, so these are surgeries that are intended to be really powerful tools that change the internal plumbing of your body to help you achieve those goals and work with lifestyle and dietary changes. They're really for folks that have a BMI, which is that relationship between your height and weight that we base things off of. If your BMI is over 35, you qualify for surgery, or if your BMI is over 30 and you have type 2 diabetes, you also qualify for surgery as a consideration in that kind of multidisciplinary approach to help people lose weight and keep it off in the long run. But they really are powerful tools. They're not the cure-all, and it's also not a last resort. I look at it as a piece in that puzzle of helping people achieve their goals, especially if they need more significant weight loss.
Can you tell me too about the recovery and what that looks like too, having a surgery like that?
Yeah, so interestingly, these are very safe surgeries, exceptionally safe. It's a one-night stay in the hospital, and people recover pretty quickly. It's not much different than getting your gallbladder out or having a knee replacement. In fact, it's a little easier than that. And so modern medicine's come a long way with surgery these days.
Well, that's great news. And Dr. Tasneem, I want to get back to you. Weight management clearly has a multifaceted approach. What are some steps that people can take to really start their weight loss journey today, would you say?
I think the first approach, when you look at weight, it's a big spectrum. You have little weight to lose and you have a lot of weight to lose. And so it all depends on the patient and how they want to approach it. But the first step is actually talking to your primary care provider. They are the source. They can if they are comfortable, they can start the journey for you. And if they are not, then they can send you to somebody that has more know-how on how to help you with this, right? So it's a wide spectrum. So I would say the most important thing for patients to remember, if you want to see a provider for weight loss, make that a separate appointment. Don't lump it up with other things. Then the focus is not there. You know, it's all widespread. There's so much other issues to talk about. So if weight loss is important for you, please make that appointment up front as a separate.
Great advice. Thank you, ladies, for being here.
Thank you for having us.
For having us.
And to learn more information, just visit the website that you see right there on your screen. That's vmfh.org/weight management.
New Day Northwest is sponsored by Virginia Mason Franciscan Health.